In Southwest Florida, we talk with a cosmetic surgeon who offers a modified facial rejuvenation procedure, one that his patients are calling a lunchtime lift.
I found over the last several years, people are looking for less surgery rather than more surgery. And a lunchtime lift is sort of a modified facelift that takes about an hour, hour and a half to do. So ideally, consequently, possibly, a woman could come in, have it done over lunch hour. Not that I'd want her to go back to work, but she should go home and sometimes stitches around 4, 5, 6 days. So it denotes a facelift that's done in a short span of time. And for the right person and for the right indication, it's a home run.
We asked Dr. Brueck how this is different.
A lunchtime lift varies from a regular facelift in the degree of undermining. By undermining, we mean, why is a woman getting a facelift? Her skin is sagging, she's got jowls. So when you have loose skin, you have to get rid of it. How do you get rid of it? You make incisions, carefully placed. You undermine the skin, that is, you separate the skin from the underlying muscle, and then you take it all back. Now with a lunchtime lift, in a person who has minimal aging, an ideal candidate would be somebody that's 37, 40, 45, has really good skin, doesn't have a lot of jowling, a lot of heaviness in their face. A lunchtime lift is a nice beginning step, if you will, into facial rejuvenation. So she can have a lunchtime lift at 40 and maybe not be a candidate for a full facelift until she's 50, 55. So it's bridging that gap. So it's minimizing it in terms of operating room time and minimizing how much tissue you undermine. And for the right indications, it's quite a powerful little operation.
Dr. Brueck told us what a patient can expect from a lunchtime lift.
I've done lunchtime lifts on people that maybe previously had a facelift 10 years ago. And they, for whatever reason, maybe had a bad experience, was done by somebody up north, they've relocated down here, they don't want to go through a full face and neck. And I point out what it will do and what it won't do. For example, many times when people age, they have bands in the neck. Well, if you do a straight lunchtime lift, it's not going to correct that separation of the muscle. Now, as long as the patient understands that, and they don't want to go through the full face and neck lift, I'll do a lunchtime lift. Maybe a woman had a facelift done 10 years ago, and she's starting to get a little jowling, but again, she doesn't want to do a full facelift. Perfect candidate for a lunchtime lift. I think the expectations of a lunchtime lift are certainly more subtle than a full facelift. And I think the dramatic effect from a facelift is enhanced by how dramatic is the defect. For example, you have somebody that's 75, they look like a Shar-Pei dog, they got jowls down to here, hanging skin. They're going to get a dramatic effect from a face and a neck lift. Most of the people that I see for a lunchtime lift are people that have early signs of aging. And the number one thing that people come in to talk to me about is the early jowling. They hate that jowling. And then they say, I find myself going in the mirror, Dr. Brueck, just a little here. And so that's a perfect candidate for a lunchtime lift. Now, when you talk about longevity, whether it's a full facelift, a face and neck lift, a lunchtime lift, a tummy tuck, a breast lift, whatever it is, how long that procedure lasts is dependent on the quality of skin at the time you do the procedure. And the analogy that I give patients is, think of skin as a rubber band. If I take a rubber band right out of the box, brand new, I stretch it, it snaps right back. It's got elasticity, it holds its shape, it has recoil. Now I take that same rubber band, put it outside, age it, heat, sun, humidity, rain. Now I go stretch the rubber band. It's dry, it's brittle, it's cracked. I go to stretch it, it breaks. So I tell people, your rubber bands are broken. So the more elasticity you lost, the more collagen you've lost, the more soft tissue you lost, the more you sag, the more you hang, the more dramatic the result will be.